Well, welcome. My name is Katie and I work at the Sacramento Public Library, where books are just the beginning. October is Health Literacy Month, and we will be featuring programs throughout the month to help get you connected to trustworthy health resources and to learn ways to care for yourself and your family. Today, we are happy to offer you Finding Health Information You Can Trust, presented by the Network of the National Libraries of Medicine. Before we get started, I wanted to just mention a couple of things. First is that if you would like to ask a question at any point during the presentation, you can feel free to use the chat function, which is at the bottom of your screen. If you just hover at the bottom, you'll see the little chat icon come up, and I'll be monitoring the chat throughout the program. If you're having any audio related issues, please exit the program and re-enter. Typically doing this will solve that problem. And if you need closed captioning, please click the live transcript button at the bottom of your screen. Also, this program is going to be recorded and uploaded to our YouTube channel, which is under Sacramento Public Library, and it'll be available within the week, so you can look for it there. And finally, I'm going to be sending an email to all participants following today's program with links to any resources that are mentioned, as well as the calendar of events for the month of October for Health Literacy Month. So keep an eye out for that. So let's go ahead and get started. With us today is Carolyn Martin. She's the Outreach and Education Coordinator for the Network of National Libraries of Medicine, Region 5. Thank you so much for being with us today, Carolyn, and for providing this helpful information. So please feel free to take it away.
Thank you, Katie. I really appreciate this. I'm going to go ahead and share my screen, and I'm going to turn my camera off so that you can concentrate on the PowerPoint, and I can not distract you with looking away from the screen. And so thank you, Katie. I really appreciate this opportunity to meet you and help increase the health literacy of your community here in Sacramento. So this is great. Thank you so much. And welcome to Finding Health Information You Can Trust session, where I hope you can learn how to be a better health information consumer. This is an overview of what is going to be covered in today's session and learning a bit about me and the organization I represent. Know how health literacy impacts health, learn some tips on how to evaluate health information, along with getting a glimpse of some quality health information and resources you can use. And as Katie mentioned, you can use the chat function in Zoom to put any of your questions or comments, and I will definitely try to make sure there's time at the end to go over those. Also, Katie will be putting some links in the chat later in the session that you can click on to some websites that we will be evaluating in a little exercise that I have for you later. My name is Carolyn Martin, and as Katie said, I am the Outreach and Education Coordinator for the Network of the National Library of Medicine, Region 5. Excuse me. Previously, I worked as a hospital librarian in Indianapolis for over 20 years and also spent some time working in a public library. Though my primary patrons were hospital staff, including administration and physicians, my favorite patrons were patients and their families. The NIH, known as the National Institutes of Health, is the nation's research agency, and many educational and other organizations receive funding for research from NIH. The National Library of Medicine is the world's largest biomedical library and is one of the 27 institutes and centers at the NIH. The network of the National Library of Medicine is the outreach program of NLM and is comprised of 7 regional medical libraries and several offices across the country. My region, Region 5, operates out of the University of Washington Health Sciences Library and serves Alaska, California, Hawaii, Nevada, Oregon, Washington, and the US territories and freely associated states in the Pacific. Its mission is to advance the progress of medicine and improve the public's health by providing US health professionals with equal access to biomedical information and improving the public's access to information to enable them to make informed decisions about their health, which is what I'm doing here today. So to be a better health information consumer, we need to understand the importance of health literacy. So let's start with a quiz. And again, this is optional, and you can put it in the chat box. What is the strongest predictor of an individual's health status? Do you think it's age, their income, their employment status, their education, their literacy skills, their cultural background, and their health? And Katie, I won't be able to see, but
We have a response that says
yeah,
income.
income. Well, definitely income is a predictor of health literacy. In fact, all of these are predictors, but the strongest predictor, oops, it's not working. Let me try that, is literacy skills. So what is health literacy? Some of you may be wondering what that means. In 2030, I'm saying last year, Healthy People 2030 recently revised their definition of health literacy into two parts. One is personal health literacy, which is the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. And this recognizes that individual health consumers may have varying degrees of ability to find good health information. Then they have to understand it, and then they have to be able to use that information, whether for themselves or for a family member. Organizational health literacy is the degree to which organizations equitably enable individuals to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. And this means that organizations have a responsibility in helping to provide personal health literacy, which is what your public library is doing with this session. I also want to mention that, excuse me, this means that health literacy, I just want to say that healthcare is very complex and that the medical profession uses their own language and has many assumptions. And keep in mind that we can all experience low health literacy. When a doctor hears that their child has been in an accident, when a teacher receives a fatal diagnosis, when someone is in chronic pain, or when a parent has a screaming toddler in their arms, all will have reduced health literacy. Navigating your way through the healthcare system requires the ability to read, listen, analyze, and make decisions in an area that is very unfamiliar to many of us. We have to be able to locate providers and services, fill out complex health forms, seek preventative health care, manage health conditions, and understand directions on medications. And many times we have to do this when we are feeling unwell or anxious. And there is a cost to limited health literacy. When we don't understand how to take medications or why a test is important, it can result in more expenses and poor health outcomes. One way to increase our health literacy is by learning how to evaluate health information. And the internet is where many of us spend a lot of time, and it provides all sorts of information where anyone can post whatever they want, whether they have the authority or the knowledge, including health-related information. And it can be very overwhelming. The quality of health information on the web varies tremendously. And there are valuable nuggets of information amid a mass of junk. People often believe that the internet is a reliable source of information. If it's on the internet, it must be true. So when you first look at a web page, ask yourself, what is the purpose of the web page you are viewing? It may be for advocacy, like the American Heart Association, for business, like a pharmaceutical company like Eli Lilly, for information such as the National Center for Health Statistics, for news such as CNN, and for entertainment like Gwyneth Paltrow's Goop website. Some of these may have health information, but knowing what the purpose of the site is will help decide if this is a good place to find consumer health information. Here's one way to evaluate health information resources, whether online, in print, social media, whatever format. And I'll go over them in a little more detail soon. So we'll look at accuracy, authority, bias, currency, coverage, and usability. And note that most resources probably won't meet all of these criteria, but the more they do, the better the resource will be. So let's first look at accuracy. Is the information correct? Are the facts stated on the website accurate? Unless the information appears in a referred to journal subject to peer review, you are depending on the authority and expertise of the author and the sources the information is drawn from. Are the sources of the information given clearly? Web standards to ensure accuracy don't exist. So let's take a look at an example. Dr. Mercola is a very popular website. Is the information linked to authoritative research? Can the information be verified in evidence-based peer-reviewed journals, such as the New England Journal of Medicine or the Journal of the American Association of Nurse Practitioners? Is Dr. Mercola's information accurately stating what research articles have published? Let's look at authority. Be sure to ask yourself these questions. Do you know who the author of the information is? An unsigned piece of information does not have the authority of an assigned piece of information. If it is unsigned, is it posted in a usually authoritative place like the National Institutes of Health or the American Cancer Society? What can you tell about the author? Is the author a student, a physician, a celebrity? Is the information drawn from the writer's own experience? Was it based on simple observation or in carefully designed research? Does the author bring any biases in posting the information? And also keep in mind that not all .coms are bad and not all .orgs are good. There is no regulation of .orgs. Note that this authority example website, allergicchild.com, is created by parents of a child who has severe food allergies. Nicole Smith is listed as the founder, but when you go to the About page that includes information about her, there is nothing to indicate that she has any professional qualifications. It even states that the information is collected from over 20 years of having to manage food allergies. Now, this website might be useful just to see what others know, but I'd be pretty skeptical unless I could verify the information from a medical association or a reputable consumer health website or checking with an allergy expert. Bias. Can you judge the author's purpose in posting the information? If the author's purpose is to persuade you or to sell you something, you must judge that information accordingly. For example, an evaluation of a medication is questionable if it is posted on a competing pharmaceutical manufacturer's website. It is more credible if it is posted by a truly independent laboratory. This is Dr. Oz's website. Do you think he might be on a soapbox? Does he have sponsors? Is he trying to sell anything? He may be giving some correct health information, but again, since he has a whole website devoted to himself, I'd recommend checking the information here with more reputable sources to see if they are in line with more authoritative websites. There's so many good resources out there. You might wonder why to even go to this one. But also keep in mind our own bias. You might be familiar with the satirical website called The Onion. Here they have cleverly included a photo of the US Surgeon General with the headline, Surgeon General recommends exercising once every several months during flash of panic about health. Now, I personally am not fond of exercise, so finding something that agrees with my point of view, despite knowing it really isn't true, makes me feel justified. We tend to look for information that we agree with or justifies our views, whether it is true or not. The currency of a website is very important. Ask yourself, is the information dated, or can you tell from the content when it was written or last reviewed? Is the information likely to change? Is it recent enough to be useful? This National Cancer Institute webpage on colon cancer treatment is an example of a current date published. At the bottom of the page, it includes that this text is being updated September 3rd, 2021. Most health information goes through continual change, so it's good to at least have a last reviewed date, even if that information isn't changing. Many websites do not have a date included. There might be a copyright date at the bottom of the website, but that doesn't mean that the information has been reviewed or updated recently. Next, we'll look at coverage. Many health websites are not comprehensive. The information they give may be accurate, but important information may be left out. Don't stop with a single site unless you can answer these questions to your satisfaction. How does this information compare with other sources, including published print sources on the same topic? Is a better source available? Consider varying your approach to searching for relevant information. Does the site have a disclaimer that describes any limitations, purpose, scope, currency, or authority of the information? Here's an example of coverage from Your Teen for Parents website. These screenshots show a posting about 3 tips for parents to help their teens who are engaging in self-harm. It's quick information that might be helpful, but as a parent, more in-depth information might be wanted than just 3 steps or 3 tips. Now, the information may be correct, but you might want to check more comprehensive resources too. Of course, you don't want so much information, which can be overwhelming, but be careful how brief it is. Lastly, think about usability, because even if the information is accurate and bias-free, if it isn't easy to follow or use, it won't be much help. Here are some features to keep in mind. Is the website too crowded with information? Can you tell the advertisements from the information? Are there flashing features in animation? Are features hard to click on or use? This WebMD webpage on vaccine for COVID-19 includes advertisements, and some of the advertisements on this website are animated that add even more distraction to viewers who are trying to find health information. There's a lot going on here, and it prevents the viewer to getting to the information they want and need. You might find the trust it or trash it method is easier to remember since it has a catchy phrase with only 3 questions. Who said it? When did they say it? How did they know? More in-depth information is provided on each of the questions, but if you can remember these 3 questions, you're well on your way to becoming more discerning about the health information you access, whether in the news, in a book, in social media, or any other format. And it can also be applied to topics other than health, such as legal information. So let's take a moment and I'll give you a chance to use those evaluation tools. And Katie will put those 3 links to these websites in the chat box, and give you about 5 minutes to try. You can just do one and we'll go over them briefly in about 5 minutes. And again, this is all optional. You don't have to do this, and we'll review at least one of these websites in just a bit. So are you ready to try reviewing one of the web sites?
I'll give
Okay.
it a try.
Okay. Let's see. Let me, you did the everyday health, right?
Yes.
Okay, let me see. Okay. All right. So here we have the everyday website. What did you think of it? Did you use some of the tips, or could you tell right away how you felt about it?
My initial thought was there's not a bunch of ads in the middle of it, like you were talking about. I went to the About Us site, which you have to scroll way down to get to. And so this was kind of like the blah, blah, blah. And then I went to see like who is on their board.
Okay.
Which is scroll down a little bit further. Yeah.
Okay.
So like this is the editorial team. So I looked at the editorial team and the first two women were doctors and I'm like, okay. And then the rest were editors. And then I got a little bit more suspicious. But then I scrolled down. They have all these experts. And then I clicked into the Black Health Facts. And they said that all the stories are medically reviewed and fact checked by the board certified specialist.
Okay.
So, and it actually says like this one was medically reviewed and it gives the person's name and when it was reviewed by.
Okay.
So kind of just looking at that was kind of where I was.
Mm-hmm.
I would tend to probably trust the content on this site more than not.
Okay. I think that, you did a good job. And this is one of those websites that I think are the kind that most people run across. They're kind of in between. I think it's not a bad website. And I think what you did to check out, that even though the articles or information posted is written by someone who isn't a health professional, at least they're trying to have it reviewed by a health professional. And that's good to know. And like you said, there isn't a ton of ads here. They're trying to be good about transparency. So it's not a bad website. I would also probably want to compare it to some other websites. I always think it's good not to get all your information from one resource. It's good to have, 2 or 3 that you like a lot and trust, and then kind of compare them with each other. It's always good to do that. So good job. Great.
Thanks. Yeah, if this was something
Uh-huh.
serious, like if it was me looking for something that was pertaining to me, this might be a place that I start, but it would not be where I end.
Okay, that's a good point. Very good. Yeah, I think, we especially want something information initially, and, and sometimes you don't want anything that's too heavy. And I agree that this would be a fine place to start. I just wanted to point out that this LASIK at Home is actually a fake website.
Oh.
It's not real. And you might think that anyway by looking at it, but at the same time, it does a pretty good job of, for some people who might be unsuspecting or really desperate looking for something, this might attract their attention. So yeah, but just wanted to let you know that there are fake ones out there. And like I had mentioned before, anyone can pretty much post anything these days.
So if you were looking at this with your things and you didn't know, because I would never do a laser to my eyeball at home, but if you didn't know, what would be like something that would stand out?
Well, first of all, I'm just going to use the trust it or trash it because it's quick and easy. So who said it? So there's nothing about here. even at the bottom. There's an
Hmm.
email, but there's nothing that says who is behind this. I mean, you've got this person's name, but there's no link to find out anything about them.
Okay.
There's no date other than the copyright date, which is 2006 at this point. So that would be, when did they say? How did they know? Well, there's nothing that has links to anything else, and they're just trying to sell something.
Okay.
Yeah. So when they're trying to sell things, especially, I get a little skeptical.
Mm-hmm.
But so that would be some of the stuff that I would use to go through it.
Okay.
But
Thank you.
if, like you did with the everyday help, looking for the about information, to me, that's always a good step. First
Mhm.
step. Yeah. And then looking at dates and seeing if the articles have links to maybe some studies or to other websites. That's also good as well.
Okay.
And like here, I'll just give an example of this Healthy Children. This is by the American Academy of Pediatrics. So for instance, if you were to look at an article, this one doesn't have a lot of links to studies, but you will find information about the person who wrote it. You'll see the last updated. You'll see that it's backed by the American Academy of Pediatrics, that kind of thing.
Okay.
So it's not perfect. We make it sound like it's super easy, but it always is, there's always that stuff in between. So just
Right.
to keep that in mind. Okay, let me get back to the. So thank you for participating in that. I think it helps to try that. And I would use those kinds of tips for every website. Just get into the habit of kind of running those questions through your mind while you're looking at it. And, it's especially helpful even for like legal information, those things that are, more serious than just finding out, entertainment type of
Right.
information. So let's move on. So keep those evaluation tips in mind, like I mentioned earlier, and use them no matter what kind of information you're looking at. Just kind of get into the habit of using those. So how do you search for information? Well, if you're like most people, you start with a search engine when looking for it, and Dr. Google is a very popular choice. But Dr. Google is not a licensed health professional or even a trained librarian. But Google gives you results, lots and lots of results. But is this the most efficient way to search? Might this look a little less daunting? On the left, if you did a search in the search box of MedlinePlus, like COVID, you will have over 5,000 results, which is still a lot of big number there. But all these results are within MedlinePlus, so they've already been vetted. And even better, on the right-hand side of the screen, you will see the screenshot of a health topic page, which was actually the first result in your search. And so take a look at how it's organized, and I will go into more detail about this a little later. But it still looks a bit overwhelming, but at least it's all organized there for you. So we're used to using Google to type in a phrase or question and results appear. And that's something we just really like. And I just want to mention that unfortunately, if you find information that answers all your specifics, you are very lucky indeed. But really, you should question that information. Even healthcare professionals want search results like the rest of us. They want that magical article to come up that answers their question exactly for their particular patient, but it rarely works that way. You have to break your question down into concepts and look for those. And so your search will be broad, but rarely specific. Please remember to take that information to your doctor and ask how that information applies to your situation. And also your doctor will be happier knowing that you are bringing information from quality health information resources. And I don't know, are you familiar with MedlinePlus? Have you used it before?
I haven't used it before.
Okay, well, let me just go over it briefly. It is a resource from the National Library of Medicine. It's their premier consumer health resource. They don't create the information, but gather it from other websites. And these links must pass a strict list of criteria before being included. And you can find out more about this in the About MedlinePlus. But here you will see categories up here at the top, as well as here on the side, like health topics, drug and supplement information, genetic information, medical test. There's a nice medical encyclopedia, which for some people, that's all they want to start with. Some healthy recipes. There's a few videos and games and things like that to make learning about your health a little more fun. There's, of course, social media presence. You can sign up for the MedlinePlus newsletter that comes out every week. There's a magazine that comes out every quarter, I think quarterly, and information about clinical trials. Easy to read information is compiled here for lower health literacy levels. You can look up organizations like, the American Academy of Pediatrics or Mental Health America. There's directories there as well, so you can find out what kind of health services are available in your area. And there's information in many languages as well. I call it the Costco of health information because there's so much there. Depending on your topic, you really don't need to go anywhere else. And I'll explain this all a little bit more detail. Oh, let me go back to that page. So here in the health topic, if you click on that, you will come to this page of health topics. Now, you can search by body, location, and systems. Most people don't know that, but that's handy, especially for kids K through 12 who are maybe doing a paper on something. So this would be a good spot for them to start with. Most people are going to use disorders and conditions, diagnosis and therapy, health and wellness, and maybe the demographic groups. So I just highlighting mental health and behavior, and the screenshot on the right shows you the different conditions in alphabetical order, and you can click on those. And this is what it looks like. This is a health topic page. You'll notice this table of contents at the top. You can click on those, or you can just scroll down. There's a little summary. You can see the medical encyclopedia that have topics related to it. If you keep scrolling down, you can see what institute is responsible for this. You can see this section called Start Here, Diagnosis and Test, all these ways they've organized it. So you don't have to go to like Mayo Clinic and the American Academy of Pediatrics. It's all kind of right here for you and organized for you. So you can see also where the information is coming from. So when you click on that, it will take you to that organization's webpage. And if you keep scrolling down, there's even more. So you can find things like what clinical trials are going on, journal articles, finding an expert, and here at the bottom, information for children, and available in Spanish as well. Again, you can also use the search box. So if you were going to type in, mental health about children or child mental health, it will bring up some suggestions of a health topic page. You can go with those, or you can just go with your phrase or a word. And again, those search results will be down here. You can refine by specific like genetics or medical test. And again, here is the first result. You will notice there's a parentheses with National Library of Medicine, and that indicates a health topic page like the one I just showed you. The National Institutes of Health, also known as NIH, may sound like it is just for researchers or health professionals, but it also includes health information for the public and educational materials for K through 12. So you can look for health information there, and brings you to this page, and you'll see things like science education resources, community resources, and so on. In addition is the health news, NIH News and Health, and you can subscribe to this. The library can, or you can as an individual, and they're just very short, and they feature a couple of topics that you can read in there, or maybe your library would like to also provide it in print and print a few out, but they are available and easily accessible. NIH also, I had mentioned to you, has like 27 institutes and centers, and you can access them from here at the top of that tab. And here's the list, and you can click on each one of those, and you'll find more health information on each of those centers and institutes. For example, the National Institute of Dental and Craniofacial Research, you can view the health information topics there. Spanish language health information is also available from NIH, and they have a page just for that. If you can't find it there, there is an Ask Carla feature right here. MedlinePlus at the top, you can switch from English to Spanish, and everything that is in the English version that is available in Spanish is available on this page. Now, it doesn't have nearly as much as the English version, but it has quite a bit. And at the bottom of the MedlinePlus homepage, there's the health information in multiple languages, and that's what this looks like. So you can search by language, or you can search by health topic within this orange circle. So this screenshot in the middle is an example of the MMR vaccine in Farsi. But if your first language or one of the patrons' languages is not English, we suggest that the language is printed out as wanted, as well as the English versions to be taken to the doctor, so that the doctor knows what that information is in that handout. Oops, sorry. Almost everyone takes some sort of medication or supplement at some point in their life. And as a patient or health consumer, it's a good idea to know what you're taking, as well as any precautions. So MedlinePlus has this drug and supplement information. So here you can search by generic or brand name. And I just want to mention that the information is from the American Society of Health System Pharmacists, which is a much better resource than the PDR. You might be familiar with what was formerly called the Physician's Desk Reference. It is now called the Prescriber's Digital Reference. Many people often think the PDR is a great resource, but keep in mind that the information is not exactly unbiased, as information on drugs is included in it, but that is created by the pharmaceutical companies who also help produce the source financially. So MedlinePlus information is a really good place to look for drug information. So if you click on a letter and search alphabetically, this is a list of drugs that start with the letter O, and I chose oxycodone. And this is one of those opioid drugs that we often hear about in the news. And I just wanted to point out, like in the MedlinePlus Health Topic page, you have a table of contents here at the top. But rather than it linking you to another resource, it's all right here, and you can just scroll down. Also notice this red box here at the top. Anytime the FDA has a warning, that will be listed at the top in that red box. MedlinePlus also has information about herbs and supplements here down below the drug information. They are listed alphabetically, and the links go to websites such as the NIH's Office of Dietary Supplements and provide information on a particular drug, or herb or supplement. So here is some of those in alphabetical order. And here is a link to calcium from the Office of Dietary Supplements. If you can't find what you're looking for in MedlinePlus, National Library of Medicine has a drug information portal, but I'm going to warn you, this is very comprehensive. It's not quite as user-friendly and it can be a little overwhelming, but it is there and it shows drugs information that start from clinical trials till they're on the market. So it's just provides a lot of links to different types of information from different resources. So it is a comprehensive resource, but I would start with MedlinePlus first. The NIH National Center for Complementary and Integrative Health is a great resource for alternative medicine or integrative health. So there are health topics. It has a section about being an informed consumer, information on pain, and they have this little interactive module called Know the Science. So it tells you about how research is done and things that you find in the news. It also has herbs at a glance. So they're just these little fact sheets about different herbs. You can also have access to that through an app. So you can either have it on your Apple phone or through an Android phone. And it's all free. And this is the Office of Dietary Supplements. It's not listed in those 27 institutes on NIH, so I've included a link in the handout. But it is also a good resource to check. I also wanted to mention the National Library of Medicine has this wonderful exhibition program that focuses on professions and the arts and social issues and diseases and history. And so right now, the traveling part of the exhibit is on hold because of the pandemic, but the online content is available, and that is really where the primary content is. The National Library of Medicine has a division called the History of Medicine, and they collect and preserve and make available all kinds of wonderfully historical material related to health and disease. So you can go in here and you can learn about the exhibition, their education modules, their digital galleries, things that I think are really fascinating. They also have a blog called Circulating Now that is really a fascinating read. And many times there's a lot of your historical societies might also be interested in some of this as well. So I'm going to give you an opportunity to try out MedlinePlus or NIH's institutes, and you can either search a topic that you want to do, or here are 3 options that you can use. Now, again, this is optional. I'll give you about 5 minutes and just give it a try. And there's not necessarily a right or wrong way, but just an opportunity for you to give one of those resources a try. So I'll be back in about 5 minutes. So would you like to go over one of these or?
Yeah.
Okay. Okay. Let me get out of this. And let's see. Let me bring up. So which one should we go with? The one about clozapine? I'm sorry if I mispronounced that.
That's the one I started with, and I just put it in the search at the top.
Okay, so tell me where to click and how you did it.
Oh, at the very top where it says search MedlinePlus. I just put it in there.
And see how their suggested terms are come up. And so, yeah. And let me make this a little larger. I'm sorry, that's kind of small. All right. And where did you go from here?
I clicked on the first article.
Okay. Took us to the drug and supplement section. Okay.
And then I reviewed that, and I saw that it was updated in 2020.
Let me go down there. Okay. All right.
And then I went back. I did look at consumer reports because for me, consumers reports is a trusted source of information.
Let me put that.
You have to, yeah, I had to hit the back button.
Oh, I'm sorry. It was one of the results. I'm sorry.
Yeah.
Oh, this one right here. Okay.
And I saw that that was published in 2013. And I didn't see that specific drug listed. But I scanned this and it seemed like it was good information just to take into consideration.
Okay. It's too bad that it linked from MedlinePlus for such an old published article, but maybe they reviewed it. I'm not sure, but I find that a bit unusual that they would include that.
So I thought that was a lot of information. And so then I ventured into telehealth.
Oh, okay. Okay, so in telehealth, where did you go from here?
Again, at the very top, I searched MedlinePlus and put in telehealth visit.
Okay. And is this what you might have looked at?
That's one of my results, but I looked at the URLs and was like, okay, not a kidney, don't have children. And so I actually went into the telehealth.hhs.gov site.
This one here?
Yes. Because it had the preparing for the visit and because it was a .gov.
Okay.
And Health and Human Services, I'm assuming is HHS. So
it's a good source. Yeah.
That's what I was thinking.
Yeah, and actually, I think this gives a little bit more information than the kidney one.
Yeah.
Yeah. And I understand. Yeah, I would think the same thing too. Well, I don't have a kidney issue. Is it too specific for that?
Exactly.
Okay, good job. All right, let's go ahead and go back to the PowerPoint. Did you have any questions about your searching that are with MedlinePlus that kind of frustrated you or you weren't sure what to do?
I think it's easy to get into, and like a lot of things on the internet, it's possibly very easy to continue down a labyrinth for many, many hours.
That's so true. That's so true. Because I've been surprised about some of the topics that are actually in MedlinePlus that I didn't expect to see there. So yeah, I won't go over those as much, but Yeah, I just thought I'd highlight a few specific health topics that you might be interested in that most people seem to be looking for. So in MedlinePlus, again, in the health topics section, this health and wellness part, where you have information about diet and exercise and wellness, you might find a lot of helpful information there, like this one for exercise for older adults. There's also one for children, different age groups. MedlinePlus has a lot of information about cancer. That's another popular topic. And this is just an example of the colorectal cancer health topic page. The National Cancer Institute, which is at NIH. A lot of people think of the American Cancer Society, but the National Cancer Institute, or NCI, also has a lot of information for the public. So here on the right-hand side, you can see that there's information for the patient, and you can also link to the version for health professionals as well. You also find on the National Cancer Institute lots of information for patients and caregivers. There's a cancer dictionary and genetic information as well. Mental health is also a big one, especially these days with the pandemic. A lot of people have been experiencing different emotions and concerns regarding isolation, and that information can also be in here as well. Again, you'll see a long list of topics under the mental health and behavior. You can also look at the medical encyclopedia. That might be a little less overwhelming to read as well. The National Institute of Mental Health has a lot of good mental health information. They also have publications that you can download or order. Your library can also make those available for you. And then they sometimes have these Twitter chats or online events that people can attend. And not all of them are, there's quite a few that are more for the public. So that's something to kind of keep an eye out. Usually they do it in this featured area, like events, but sometimes they don't give you a lot of notice when those are happening, but that's another good place to go.
Hey, Carolyn, there's a question in the chat that says, how does NIH cancer page compare to American Cancer Society website? So what are some of the differences with it?
Well, I have to admit, I think it's good to look at both personally. So NIH is going to focus more on their research and their information. American Cancer Society, I think, definitely has more of a public and patient presence than NIH does. So I think it's good to look at both. I used both when I was working at the hospital library, but we found that sometimes NIH goes in a little more detail than the American Cancer Society, but not always. It all depends. So yeah, just like I said before, use 2 or 3 resources to find information. Now, these are just 3 screenshots of different things that you might also be interested. There's a health topic page on talking with your doctor. There's a tutorial to understand medical terms. There's also one for evaluating health information. And there's this telehealth topic page as well. The COVID pandemic has really highlighted the importance of health literacy and evaluating health information, specifically in regards to news, whether from mainstream news sources, social media, websites, and scams. Part of the problem of finding trusted information about COVID was that many of us experienced with the overwhelming bombardment of information, especially at the beginning. Even with authoritative resources, information one day was one day one thing, and then the next day it changed. It was hard to know what to believe or what to do. And this is true of any health crisis or your own personal health. So our human nature wants certainty, and we don't like change. And science takes time, and information changes as scientists learn more. So thank goodness it does change, or we'd still believe the world is flat. But this is from the World Health Organization. This is a little infographic on how to navigate what they called the infodemic, with the glut of information about COVID. And these are kind of similar to what we did to evaluate websites. You would also use to apply for health news. Health misinformation has become a crisis and threatens public health. And the US Surgeon General published a 22-page health advisory asking journalists, the tech industry, government, and other institutions, as well as the general public, to take responsibility and do what we can to slow the spread of health misinformation. And how can we do that? One way is to simply not continue the spread of misinformation. Your friends or family may share with you some news that don't meet those various health information evaluation tips that we went over. No need to pass that questionable information on to others. Another way is to engage and listen and ask questions. You could say something like, I've heard many people believe that. It's scary and confusing. I've been using this tool I heard about at the library called Trust It or Trash It, and I find it helps me know what information is more authoritative, or something like that. And let's not forget about celebrities. They like to think of themselves as health experts. Many people will follow a celebrity's advice rather than their medical provider. Watch the British Medical Journal video. It's a great one. It's from 2013, but I still find it very interesting. It's about 15 minutes long. It provides greater understanding about when we shouldn't be following celebrities' health tips. For example, if a celebrity is working as a representative of, say, the American Heart Association, that is very different than just stating their own opinion or experience. Here are a few resources available to help you navigate health news. This first one is called Healthnewsreview.org, and it is an excellent source, but its funding ended in 2018. So some of the news stories are not really being covered anymore, but they have a toolkit. They have you can read older news stories that they've reviewed. There's just some things there that might be very helpful. MedlinePlus has a health topic page called Health Fraud, though it's not the same thing as health news. It does help you kind of navigate your way around when lots of those scams are going around, especially during the pandemic. And I mentioned the National Center for Complementary Integrative Health has this interactive module called Know the Science, and they have a section in there called Know the Facts About Health News Stories. And this is mostly regarding complementary health, but I think a lot of it can be transferred to any kind of health. And even though this says it's for teens, kidshealth.org is a great website. It's often linked from MedlinePlus. They have a section for parents, for kids, and for teens. And this one is called Figuring Out Health News. And I still found it very useful. So don't be dissuaded by the fact that it says teen at the top. And how can you keep up on health information? Consider subscribing to the MedlinePlus weekly newsletter, the quarterly NIH MedlinePlus magazine, and the NIH News and Health that comes out monthly. And they all come through email. And I want to say a little something about libraries. As you already know, your library is a wonderful source of information. Take advantage of it. When visiting the library, know that you have the right to privacy and confidentiality, especially with health information, which can be so personal. And Katie can jump in here too at any time. Help the library staff by having the correct name and spelling of the medication, the diagnosis, the surgical procedure, If you don't know or can't remember, the library cannot and should not provide information. Go back to the doctor, ask for it to be written down, and then you can go back to the library. Many medications and health conditions are very similar sounding, but they can be very different, and you don't want to receive the wrong information. Library staff cannot give you advice or recommend a doctor or a medication. They cannot diagnose. Library staff are not healthcare professionals. And if by chance they are, they also have our nurse or a doctor, or you have a volunteer who is a healthcare professional. When they are in the library, they are working as library staff or as volunteers, not as healthcare professionals. Not all health information is in a book or in print. These days, much of that information is online, whether through a website or a resource your library subscribes to. Expect the library to provide health information from trusted and authoritative resources. If they cannot find information in those authoritative resources, they shouldn't provide whatever shows up from whatever they can find. And when it comes to your health, you don't want substandard health information, just as you wouldn't want substandard health care. And always take the information to your healthcare provider to see how it applies to your situation. And I have a little bit of a fun activity if you'd like to participate. You can use your, is it the little reactions, Katie, on Zoom? You can use the thumb up or the thumb down, or you can put your answer in the chat box or just say it out loud. So, you ready? Let's see. These are all true or false. Only people without a college degree have health. Let me start that over again. Only people without a college degree have low health literacy. True or false?
We have an answer that says false.
Okay, correct. Trust, because anybody can have low health literacy. It can be situational as well. So trust it or trash it is a tool to help evaluate health information.
True.
That is true. It's an easy one to remember, hopefully. All .com websites are bad and all .org websites are good.
Response says false.
That's correct. You will find a mixture of those. So there's no regulation with .org. MedlinePlus is a trusted and authoritative health information resource from the National Library of Medicine.
That one says true.
Correct. And your librarian is the best person to ask for healthcare advice.
That one says false.
That's correct. Your librarian is the best person to ask for health information, not healthcare advice. So great. Thank you so much for participating with that. And so now it's your turn to ask any questions or make any comments. I'm happy to do that. And there is a hand up that Katie will provide for you.
I found this very, very educational and helpful. When you send the links out to me, I will definitely be forwarding on the links to the recording to my friends who are interested in this type of research. It's unfortunate that we had a low turnout today, but I really appreciate you guys continuing on, even though you only had one participant.
Well, we're glad to have you. So I'm glad to, we reach one person. That's always great. So
yes, I would love to have the handout because there was a lot of links in there and a lot of information that I'd like to be able to go back and retake a look at and actually have time to explore.
Yeah, and Katie and the Sacramento Library can also answer questions, or they can forward it on to me, or you can contact me directly too. It doesn't matter.
Great.
But yeah.
So thank you very, very much for Caroline
welcome.
for being here, and for the Sacramento Library for continuing to do these types of educational webinars. It's just a phenomenal resource from our library.
Wonderful. Thank you so much. And we appreciate you sharing out that information. That's always important to share the good information and good resources. And Carolyn, if you'd like to go ahead and stop sharing your
Oh,
screen.
yes.
Thank you. There I am. Well, thank you again so much for joining us for finding health information that you can trust. And a big, big thank you to Carolyn. What wonderful information and great reminders sometimes of things to look for when we're looking for health related information on the internet. That's really wonderful. For more information about our health initiatives and upcoming virtual programs, just go to www.saclibrary.org. So for Carolyn, for myself, and for the Sacramento Public Library, thank you so much and be well.
Thank you. Have a great weekend.
Thank you, you too.